Living with multiple sclerosis can be exhausting and debilitating, and at the same time incredibly unpredictable because the symptoms can come and go. Today you'll learn the journey of one patient who went from dancing on stage to losing his mobility and his vision in just 3 months. Good morning, I'm Alexis Del Cid. Welcome to All Things Brain Health. This week is Multiple Sclerosis Awareness Week. Around 2.9 million people in the world live with MS. MS is tricky. It's a chronic autoimmune condition where your immune system mistakenly attacks the protective covering around the nerves in your brain and in your spinal cord. So this affects how your brain communicates with the rest of your body. And MS looks different for every person. Jasper Mumford is here with us today. Jasper was diagnosed with multiple sclerosis at age 20. Thank you for being here.
Absolutely.
And we are also so pleased to welcome neuroimmunologist and MS specialist, Dr. Daniel Mafla. Dr. Mafla, thanks for taking the time.
Thanks for having us.
Jasper, we were just talking. First of all, how are you feeling today physically?
I feel great. I have a show today for a show I'm in right now at KU. Yeah,
show?
I feel great. It's called, oh my gosh, now I'm blanking out. It's called Corners Grove. It's an adaptation of an older play, actually, called Our Town. And yeah, it's kind of just about coming of age, a lot to do with identity and where your home is. It's a really cool show.
Do you have any of the symptoms that you had previously?
I have a couple. I still have some tremors sometimes when I get nervous, or if I'm doing something for the first time, or if I'm tired, I'll get a little shaky in my legs or my hands. I also still am blind in my right eye, actually. That was my first initial symptom, and that's kind of what, again, first led to my MS diagnosis, I think.
You were 20 years old.
Yes.
You were just finished your freshman year in college. You were living in Chicago at Roosevelt. What did you first notice and when?
The first thing I noticed was the summer after my freshman year. I was in Lawrence, where I'm from, and I was in a show, and I noticed one day when I woke up, I was like, my vision looks a little bit different, and I wasn't quite sure what it was, and then eventually I put my hand over different eyes, and I was like, oh, I can't really see out of my right eye. And then I led to me going to ophthalmologist and an optometrist.
Earlier, though, before the show began, you said you went on and kept performing.
Yeah,
that night?
I kept performing because I didn't really know what to do, and I was just like, it doesn't affect me too badly. I could still kind of do my dance moves and stuff. I just obviously had to look out for anything that was on my right side.
You went totally blind in one eye?
Yeah, I think it started out a little slow. I think it was kind of like it began being foggy, but it was dark, and I wasn't quite sure why. But then over time, it kind of all started fading, and now I have a little bit of depth, or a little bit of eyesight in there. It's kind of like looking around in the dark, though, with just my right eye.
Okay, but your left eye is
Yeah, my left eye is pretty good, pretty functional. I think I have like 20/30 vision, so pretty accurate.
So how long did it take to go from going blind in your right eye to an official diagnosis of MS?
It took about 3 months, 2 or 3 months, because at first they weren't quite sure what it was. I started taking steroids to kind of help see if that would resolve the optic neuritis, but it kind of didn't work, and eventually I started getting kind of dizzy when I was in rehearsal for actually a different show that was at KU, and I was like, oh, maybe I need to go see a doctor at a hospital. So then I went to the ER at LMH, Lawrence Memorial Hospital, and that's kind of when everything started. I got an MRI, which I think eventually showed that I did have multiple sclerosis.
Okay, and then at what point did you come here to Dr. Mafla and his team?
I think that was a little bit later. I ended up getting transferred from LMH to the University of Kansas Medical Center. I think just because they couldn't quite figure out how to stop the progression, and they needed new options that they didn't quite have available at a smaller hospital.
So Dr. Mafla, Jasper comes to you, and within 3 months he's lost vision in one eye, and you had lost your mobility?
Yes. I lost the ability to walk. I wasn't really functional, able to get around anymore. I was predominantly just using a wheelchair.
And for a performer,
yes,
for anyone that's rough, but you are in school to become a performer.
Absolutely,
A performer.
yes. I was a musical theater performer.
Dr. Mafla, is 3 months considered a fast progression, typical progression, slow progression?
3 months with things happening this quickly would speak of our very fast progression that it's, actually let me rephrase it, very fast, a lot of inflammatory disease activity. It is not usual for MS to behave this way, so that speaks of a lot of inflammation in the first place. And just to have an idea, for example, a patient with MS will have 1 relapse every year to every 2 years. Jasper had many different scars that you can argue many relapses in only 3 months. So that speaks of a lot of inflammation.
When you say relapse, I think of the symptom going away and coming back and going away. So at one point, were you, during those 3 months, able to walk and see? And then it
no, not for me. I was never able to walk or see.
So what is, I'm trying to pinpoint,
right.
What does it mean to then relapse? Is that something you see in the brain that has happened?
That's a great question. So a relapse in MS usually happens very different compared to a stroke that hits you 1 second to the next one, right? In MS, you usually have something happening, exactly what Jasper describes, a little blurry vision, maybe color is not as bright or light is not as bright, gets worse over the period of a few days to maybe a couple of weeks, then it stabilizes, and a lot of times it gets better on its own. But if you keep having more inflammation, more attacks, you're just going to have more and more symptoms causing more deficits.
We talk about the protective sheaths in the nerves being attacked as an autoimmune response. Is that directly, how does inflammation come into play with that?
So the immune system triggers an attack to the coating of the nerves called myelin, and that causes the process we call demyelination. And that's what kind of start causing the symptoms that MS can cause, weakness or fatigue, cognitive slowing, numbness, or vision problems. And usually, after you had an attack, your body, if we cool down the inflammation, your body can heal to a certain degree, but that recovery happens in about 3 to 6 months, sometimes even up to a year. So when things happen in the first, so fast as in Jasper's case, he wouldn't be able to recover in between attacks. He just had multiple insults, in a very short period of time, every week. Who knows how often, but it was very aggressive, very inflammatory.
Jasper, what was the treatment that Dr. Mafla put you on?
I ended up doing cyclophosphamide, actually, which was a chemotherapy drug, from my understanding, and it was definitely a scary kind of realization for me that I was on like a chemo drug, because I typically associated that with different types of cancers, and I had never gone through anything like that. And it was definitely it was kind of an aggressive treatment, but it was also the first thing that stopped the symptoms from progressing. So I was also relieved we found something that was making my symptoms better, or me having less attacks, which was great.
It's been 4.5 years now.
Yes.
You're on stage, you're back performing, you go to KU now. How quickly, or it probably felt like forever in your world,
yes.
When did the symptoms finally go away to the point where you could walk and see out of, well, you still can't see out of your right eye,
yes.
You can walk and function?
Absolutely. It was kind of a slow process. At first, I definitely noticed it took a lot of therapies and different medical interventions kind of to help stabilize those symptoms and kind of recover a little bit. But
we have pictures of you in your therapies.
That's amazing. Yeah, it was definitely a long process, but through those things I slowly got better. I did speech therapy, occupational therapy, physical therapy, and all of those made a big difference in terms of slowly getting my cognitive speed back and being able to walk. That was a big goal for me, I remember, in physical therapy, and I was so excited the first day I stood, I remember, for the first time by myself, and it was, a huge deal, but it definitely took, I would say probably 2 to 3 years until I started finally predominantly being out of my wheelchair and walking around. And of course that went through slow stages of using a walker or a cane or a rollator and all of those things, slowly to mostly walking today without one. And sometimes I will still use a cane if I feel like super tired or am just struggling more that day. But yeah.
Such an unpredictable disease, Dr. Mafla. Can the symptoms, these symptoms came on like a wave within 3 months for Jasper. Is it possible for someone like Jasper to have those symptoms and then they go away as quickly as they came on, or does it always take years to go into
No,
remission?
actually Jasper had a very aggressive form of MS that, this inflammation was nonstop for the entire time during those 3 months. So. But usually the norm is that once you have a relapse, it depends on how severe it is. Some patients can recover from a relapse fairly quickly in just a couple of weeks. But sometimes, as a rule of thumb, we tend to counsel our patients that after a relapse, the first 3 months are going to be very important. At the 6-month mark, you might know where you're going to end up in terms of that recovery. But when it's very aggressive, it can take you, literature suggests, up to 1 year, sometimes even up to 2 years to kind of know what's your new baseline going to be like. And that's kind of where Jasper ended. When I was in clinic seeing him around the 2-year mark, since then there hasn't been a lot of changes, but in the first 2 years it was amazing seeing him that he, from a wheelchair, 7 months into therapy, then he was standing up, then he was using a cane, then he was using a walker, and we were seeing him every couple months. So seeing that improvement was very, very rewarding. Also, from a physician side of things, that's what you want to see in your patients.
So many people out there, we associate MS with mobility issues, but it might be new to some of our viewers at home that MS can also affect your sight, and in Jasper's case, he went blind in one eye. What's happening in the brain that took away Jasper's vision? That's
right. So MS, we call it multiple sclerosis. Sclerosis is just a fancier word for scars. So you will have multiple scars because of that inflammation in your brain, spinal cord, and optic nerve. Optic nerve is also part of the central nervous system. And here in this picture, we see how that immune response, that inflammation, is essentially chewing the coating of the nerves. And that is what we call demyelination. And we can think of the nerves as wires, electrical wires that have insulation around them to help them function faster and better. And when MS attacks the myelin here, essentially you are making the communication inside the nervous system less efficient, and that will cause the symptoms of MS in the first place.
Can that coating grow back?
And that's a great question. So if we catch the inflammation early enough, we are essentially just preventing more inflammation and then buying the own body to heal on its own. So you can heal partially. That process is not perfect, but that's why you see patients after a relapse that they get better over time. But if we don't stop that inflammation soon enough, that can damage the underlying nerve fiber itself, something we call axonal damage, and that is much harder to bounce back from.
So how important is early intervention and an early diagnosis?
It's extremely important. I think that has been the main focus of the field for several years now, because our therapies are actually preventative in nature. Unfortunately, we just don't have enough tools to repair the damage that has already been done, but our drugs are going to prevent additional accumulation of deficits or disability, and that's why it's important to start early on to preserve the neurologic function.
Jasper, I met your mom before this program, and she's so sweet. And
Absolutely.
From a mom's perspective, I can't even imagine what that was like to see this happening to her son. And for you, emotionally, how did you grapple with this diagnosis that was taking away things that are so important to you and what will be your livelihood as well one day?
Yeah, it was definitely really scary. When I was first admitted to the hospital, before having MS, I had no other really health scares ever in my life. I had never really stayed at the hospital beyond anything like getting stitches, which is kind of an easy solution in comparative to something that's like a little less determined on what your life's going to look like. Because I remember kept asking, like, when am I going to be able to walk again? Is my vision going to get repaired? And there was a lot of kind of unknowns at the time. It was just like, we're not kind of sure. It kind of depends on how you respond to these medications. And of course it took several different medications to kind of figure out what was going to be the best for actually stopping the progression. So it was, yeah, definitely really scary, especially as a performer. I didn't know, again, what my life was going to look like, but I also learned a lot about like disability awareness and advocacy, which was amazing. Like my first show I did after being diagnosed was I was in a wheelchair, and that was, again, a scary process, but I learned a lot about just showing up and kind of being that representation that a lot of people don't get to see. So it was really cool.
Was your character in that specific performance written to be in a wheelchair? Or was the script accommodated, or was it not an issue? They said, okay, you're in a wheelchair, you're still going to play this guy.
The character was not written to be in a wheelchair. It was just it was School of Rock, actually, the musical. So it was
it's a great musical.
Yeah, and I actually played one of the parents of the kids, which makes me feel old because I was definitely, as a 21-year-old or 20-year-old, not used to playing a parent in something before, but yeah, it was just a regular parent kind of dealing with the kid. The kid was the guitar player of the band, and I was just his parent, kind of struggling with regular parent issues.
What's great about that is they didn't make you being in a wheelchair the plot line.
Absolutely.
I love that. It's just you happen to be in a wheelchair.
Yeah, and they even built a lot of the set with at least me in mind, which was super helpful in terms of like getting through doors, not having like a lip, so I could actually move through with my wheelchair seamlessly. And that was really helpful. And yeah, I think a big eye-opener for even people in the show that had maybe never dealt with that particular issue before.
Dr. Maflo, when it comes to the treatment, you say that you used what you consider to be an old-fashioned treatment at first on Jasper. What's an old-fashioned treatment?
That's right. By old-fashioned, we mean we use cyclophosphamide. That is not a medication that was intended only for MS. It's a strong chemotherapeutic drug. It's a strong immunosuppressive drug. But, you know, in someone so young where the stakes are so high, you know, you need to be more aggressive. We usually use in the stroke world, time is brain, but the same principle applies here. We need to cool down that inflammation as soon as we can. And, you know, we try steroids. Sometimes we try plasmapheresis to filter all the molecules driving that inflammation in the first place. But Jasper was not responding to those treatments, so we knew we needed to do more, and we only have a couple of options after that, one of them being cyclophosphamide. That is not something you want to do you know, in the long term, but it serves more of a short-term induction therapy to essentially reset your immune system, cooling down inflammation as quickly as we can.
And that's the one that you said is like a chemotherapy?
Yeah, that's right.
So is that the newest therapy out there?
Actually, no. This is a relatively old drug studied in patients with cancers, but the way it acts is a very powerful immunosuppressive drug. So it's not MS specific, and it's actually very old, and that's what we meant by old-fashioned.
Oh, okay. So the old-fashioned is the
cyclophosphamide. That's right.
And what is the new version of the treatment then?
So MS has evolved so much in the last 15 years, so now we have over 20 drugs to pick from. So we try to pick the profile that fits our patient's lifestyle, priorities, even route administration. You know, some patients might prefer an injection or a pill or an infusion. But, you know, the key is that we have a very big toolbox that we can pick from that can provide the long-term care that is equally effective, but much safer, especially compared to something like cyclophosphamide. Again, that's not something you want to do in the long term, but the new MS drugs have a much better safety profile when you need to use them for, you know, for maintenance therapy for many, many years.
We have a pretty incredible system here. The health system is connected to the MS Achievement Center, which is a wonderful program. 3 days a week, MS patients are able to come and exercise, undergo physical therapy, and also go through some mental health exercises as well. Jasper, we've talked about the physical therapy. When it comes to mental health and dealing with the unpredictability, what exercises with your mental health help you the most?
I mean, I definitely think seeing just therapists to kind of deal with the big toll that kind of being going through so much medication or being a person living with MS, I think is super helpful. And even during some of the therapies I was at, we had group therapies, which were just about kind of talking about our illness and just kind of getting to understand what it means for us and how it affects our lives. And I think it was very empowering. Like I did a lot of my therapy in a day program at Ability KC, actually, and they had so many people with a variety of issues. Like some people had strokes, some people had traumatic brain injuries, and kind of just talking with all of them. And it was interesting seeing so many of the similarities we had, but also so many of the differences, and kind of how illness just looks different for everybody. And it was great seeing how I could support people more with disabilities, and it was a very rewarding process, and I learned a lot.
Do you still do physical therapy? And if so, what physical therapy has helped you the most?
I do still do physical therapy, kind of intermittently.
Is that you? Is that part of your physical therapy? Dancing?
Yes, yep, it absolutely is. I mean,
awesome.
At least for me it is. It wasn't technically part of my physical therapy, but it was something I like to do to just move around, move my body. I didn't even know that was there, so that's funny.
Where was this taken?
This was at my house. This is at my apartment. But yeah, there's my cat post there, and there's me walking around kind of in my old trails I used to go on, and just practicing moving my body and kind of getting used to walking around, because I wanted to walk so badly, of course, after getting MS, because nobody expects to, I guess, lose their ability to walk, especially as quick as it happened. So it was it was a goal I really wanted to come back to, being able to walk and move around, and
you did it.
Thankfully it's worked out pretty well.
We have some great questions and some comments that are already coming in, so this is how you can connect with us right now in real time. If you have a question or a comment that you'd like us to read out loud on the program, send it to us on YouTube or Facebook, and you can find the links right there on your screen. So Jasper, compared to where you were last year, it's been 4.5 years. Let's just go back 12 months compared to now.
Yeah. I would say I am doing a lot better, especially just socially and interacting in the world. I think after getting MS originally, I became pretty isolated just because I was uncomfortable going out in a wheelchair or going out into spaces that just looking or feeling different than I used to before. And there are a lot of obstacles, of course, with like accessibility that makes a lot of that very scary. But now I restarted school in the fall, which has been really great at KU, and I'm starting out slow. I'm just taking like 6 credit hours, but it's a great starting out point for me, and I love being back in a community kind of with people my age, and doing the things I love, so it's really great.
Dr. Mofflow, when it comes to the MS Achievement Center, the one we have here at the health system is one of only 6 like it in the country. What makes it so unique, and I imagine you get people coming from all over?
So that's right. MS Achievement Centers in the last 10 years, we've had maybe 4 to 6 over the years. Some of them stopped functioning, some of them open back. But let's say, I think right now it's 4 in the country.
Oh, only 4 in the country, and
that's
we're
right.
4.
And I think we're very proud of having that achievement center, because it is intended for patients with progressive forms of MS that have acquired significant amounts of disability. It is very different from traditional physical therapy, because it provides a longitudinally holistic wellness program. For example, when you do physical therapy, you might be limited to a certain numbers of weeks a year, depending on your insurance, but this will provide a longitudinally wellness program that, as you said, is not only exercise, but you have cognitive exercises, you have hobbies, art, music, you name it, and this also provides a sense of belonging to these patients, to create community, to feel that they're not alone in their disease process. And and also gives caregivers a structure, knowing that their loved one is in a safe place, that is being supported, that is engaged for at least one day for 5 hours a week. And the other major difference is the funding. It's not billed through insurance. The cost for an individual member is about $100 per month that they need to, pay out of pocket. But we do have financial assistance programs for the patients who require it. But the actual cost to provide all the services to single member is about $500 per month. So to cover that gap, we have a lot of different, grants, and we have fundraisers. The two major big ones are going to be the Race to Nowhere that happens around March of every year, and then we have the Eat, Beat, and Laugh that happens in September of every year.
Okay.
This provides the funding that we need for our Achievement Center.
How wonderful that you're not grappling with insurance.
Yeah.
And that people aren't battling insurance companies to get the therapy that they need.
That's exactly right.
We have some of those questions coming in, so I want to get to them right now from our viewers. Jen wants to know, this is a good question, is MS something that you're born with that flares up at a certain age, or does it develop? Dr. Mafla.
It is something you acquire. It is not a genetic disorder. You can have some genetic risk factors, but the risk is actually very, very low, even if you have a first-degree relative with MS. So we think it's kind of like multiple different factors that need to align all together in order for someone to develop MS, but it's not genetic. It is an acquired disorder.
Well, that was the second part of Jen's question is, well, then where does it come from?
Yes, that's actually a very loaded question. We know a lot of risk factors, but there's a lot of things that we don't know. Some interesting ones are going to be vitamin D deficiency, for example. So even taking vitamin D appear to be a healthy thing to just do. The farther away you go from the equatorial line, north and south in the world, the higher the risk of you to have MS. It might be sun exposure.
Really?
It might be vitamin D, maybe radiation can play a role into that.
Did you get your vitamin D checked?
I did.
And what was it?
Absolutely. You put me on the spot,
Oh,
but
sorry.
it was low.
Was it low? It was super low?
It was low. We want to keep it above 30 picograms per milliliter. I think in his case it was 20 or below 20.
Okay.
But it's not the only risk factor. We know there's a genetic component. I mentioned some of them. Interestingly, smoking tobacco appears to be a risk factor not only to have MS but also to make your MS worse. And something relatively newer, it appears that Epstein-Barr virus also appears to be playing a role, is a required factor in that chain of events.
The Epstein-Barr virus?
Epstein-Barr virus, appears to be a required but definitely not sufficient enough risk factor for someone to have MS. In other words, don't worry too much about it because over 95% of the general patient in the community, we are exposed to that virus. So
I want to ask you real
yes,
quick,
please.
Epstein-Barr, people might not be familiar with that. Is there a simple way to explain what Epstein-Barr virus is?
Epstein-Barr virus belongs to the family of herpes viruses.
Okay.
It's a very common virus that we probably essentially, most of us, if not all of us, will be exposed to at some point during our life.
Okay.
But when you are not exposed, that little 2 to 5% of the general population that are never exposed to this virus, their risk of having MS drastically drops. And a lot of more things to learn about that, but that kind of appears to be like, in an overly simplistic way, all the risk factors that can cause someone to have MS in the first place.
Kim Bosley Moore asks, taking vitamin D, should you also take vitamin K magnesium with it?
Not necessarily. Those are not known to be associated necessarily to the risk of having MS. Magnesium has other benefits, but if we're talking exclusively about MS, that's not necessary.
I love this conversation, one, because it's obviously fascinating, but you're such a survivor, and you're still going, and Jasper, you're back performing.
Yes.
What do you most wish, as we wrap this up, people watching would know about MS?
I would say that just kind of MS looks very different for a lot of different people. I've met people with MS who, again, have predominantly spent most of their life still using a wheelchair, or predominantly get their eyesight back after getting optic neuritis like I did. But so yeah, I would just say it's a spectrum, and for people it looks very different. So to not come with any like preconceptions of what maybe MS looks like. I get so often that like, oh, when I tell people I have MS, they're like, oh, my grandma has MS, and they think, I think they come up with a lot of assumptions of what they think.
It's just like their grandma.
Yes, exactly.
Right.
But yeah, it just looks different for everybody.
Dr. Mafla, what do you wish our viewers knew? What's the takeaway?
I would like to say that in this area of MS, or MS care nowadays, have given our patients their right of worry, to worry about things that everybody should have the right to worry about, meaning, you know, your career, raising a family, fitness goals, and realistically speaking, now that is there's a lot of hope, and that is a very reasonable goal nowadays. And so, you know, with our multidisciplinary care, if things happen, well, we'll deal with them as we go along, but we want to be with our patients during their MS journey for them to, you know, living and thriving with MS, as opposed to dealing with MS and worrying about it all the time.
Let Jasper worry about college stuff.
Exactly.
That's right.
It's tough that a college kid should be worrying about and not MS.
Exactly
Dr.
right.
Mafla, thank you for the time and all the important research and care you're providing. And Jasper, thanks for sharing your story.
Absolutely.
And raising awareness.
Yes, thank you for having me. I'm so glad to be
We're
here.
really happy that you're here. And thanks to our viewers for joining the conversation. Coming up tomorrow, it is a milestone few hospitals have reached, and it's providing a huge benefit to patients here at the health system. We celebrate the procedure that eliminates the need for you to go on blood thinners tomorrow at 8 a.m.